LifeLab is an educational programme based at the heart of University Hospital Southampton. We are set up primarily to work with teenagers, so 11 to 18-year-olds at secondary schools, sixth form colleges. But recently we've expanded to open a programme for primary schools, so working with younger children as well. LifeLab is a programme of work that is set up to engage young people with science behind health messages. We work through schools primarily, working through the science curriculum. It's a programme of work which involves teacher professional development to start with, to engage the teachers with the programme. And it's very much set up to not burden teachers, so we don't want this to be another thing that we're asking schools and teachers to deliver to our young people. We provide all the resources for a series of lessons delivered in school, and then young people come up and spend a day with us here at LifeLab to do a day of hands-on activities, learning about those science messages. LifeLab is a university project primarily, and so we're always looking to evaluate the work that we're doing and measure that impact that we have for young people. Anecdotally, we hear all the time from students themselves, from their parents, from their teachers and from schools about the impact that LifeLab has had for them. The work that we do is really about engaging young people with the science behind health messages to allow us to be able to think about the lifestyle choices that we make. And actually it's really important to us to think about what that impact is for our planet's health as well, because the choices that we make in our lifestyle for our planet's health are actually all really good choices we can make for our own individual lifestyles too. One of the reasons for the success of LifeLab has been the partnerships that we've built up over the years. Obviously we're here in the hospital, so we have a strong relationship with the University Hospital Southampton, but importantly within the university it's very much been a collaboration between the clinicians and the researchers through the Faculty of Medicine and the educators within the Southampton School of Education. There are so many exciting developments in the pipeline for us. One of the major things is we've recently moved from being within the Southampton Education School to being in the School of Healthcare Enterprise and Innovation. It's really important for us to think about how we provide a sustainable offer for schools in our local communities, and hopefully the work with the School of Healthcare Enterprise and Innovation will give us a model through which we can do that. We have LifeLab programmes developing in Dublin in Ireland, in Sydney in Australia and Soweto in South Africa. So really wanting to understand how the model and approach we have here in Southampton can be replicated and delivered for young people across the globe in different contexts. Too much work for young people is done behind closed doors and young people aren't involved in those conversations. It's really important to us that we're involving young people in shaping the work that we do. So we have recently established a youth panel where we employ young people to work with us on all the projects that we do, but we've taken that and expanded it even further to train young people as researchers themselves so that they can tell us what we should be researching rather than, again, it always being directed by a kind of adult perspective. I can't imagine doing anything more rewarding than working with LifeLab. It brings together my love of working with young people and really wanting to explore how we enable them to live their best lives, coupled with my love of science. Science is all around us, and actually we need to know how to engage with science, how we use evidence to inform the choices we make. And so bringing those two things together is the best job I could imagine doing.